Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about public health preparedness, why volunteers matter. And our special guest is Melissa Paulus, who works in the Public Health Preparedness Office of the Frederick County Health Department. Melissa, welcome. Thank you for joining us.
Thank you.
All right, well, let's just jump right in. So, in what ways does the Frederick County Health Department need or use volunteers?
Well, in a large-scale emergency, from a preparedness standpoint, we would think of volunteers to come and help us for that event. However, the reality is, in a small-scale emergency, we would ask volunteers to come and help us so that other health department staff can then participate in their daily jobs and help keep services running for the community.
Oh, okay. So what kind of volunteers could you use then?
We would use all kinds of volunteers. We often ask for medical staff like nurses or physicians or pharmacists, mental health professionals. However, we would ask anybody to come volunteer that's interested in helping their community.
Okay. Well, do you provide any special training, or do you expect that people come and already know what to do?
Oh, there are trainings available of all kinds. The Department of Mental Health and Hygiene offers online trainings that they could take at any time at their leisure. But the health department also offers local trainings for medical staff and for non-medical staff. Some of the medical staff training that we've done this year is we've done vaccinator training, like a refresher, just to help nurses get comfortable with vaccinating if that's not something they do every day. And then we also have done mass care shelter training for nurses. Some of the non-medical training that we've offered, we've done incident command system training, we've done psychological first aid, things of those nature.
All right. Well, what kinds of things might both those health professionals and the non-health professionals do to support the health department?
So we would ask them to come and, as I said, do vaccinations during a clinic. And in that clinic setting, we might ask non-medical staff to hand out forms or help our lines move slowly. And then we would also ask them maybe to work in a call center. That's something that we've done recently. We had an exercise and training, and volunteers came and helped us in our call center.
Okay. And then, so how can somebody who wants to volunteer, how can they sign up?
We are very fortunate in Frederick that we have a large history of volunteerism, and the state of Maryland recently has an online registry for volunteers. So it's Maryland Responds, and they would just go to the Maryland Responds page and they would be able to sign up as a volunteer. The website allows them to sign up as a volunteer from where they live, and then they can choose to sign up to be a volunteer in Frederick County or any of Maryland.
Okay. And so if somebody signs up to be a volunteer, are they obligated or required to respond anytime there's an activation?
Oh, absolutely not. Responding is always voluntary, and we understand that who responds to an event is based on their schedule and the event itself.
Okay. Oh, that's good. And how are people notified?
With the system, it allows the health department very easily to manage our volunteers. So we would send out an email or a phone call through the system. And the great thing about the system is it definitely allows every volunteer to manage their own contacts, so they can do that as they need to.
All right. Well, in case there are still people out there wondering, well, what's in it for me, or what are the benefits of volunteering? Can you talk a little bit more about maybe some of the benefits that people might get besides helping on the day of the event, but what are some other benefits of volunteering?
Being a volunteer allows them to be trained and have that information ahead of time if they wanted to come and volunteer. And getting the trainings, I think, gives them an insight to help them be better prepared, and also that could help their families be better prepared, and it does help the community as a whole be better prepared.
Okay. All right. Boy, that sounds really good. So is there anything else that you'd like to add about public health preparedness and response volunteers?
I do think we had set a goal this past year to increase our volunteer pool in Frederick County. So our goal was to exceed it over by 10%, and we did that. And so at this time we have 142 volunteers in Frederick County on the Maryland Responds webpage. And if you would like to volunteer, I just encourage you to go onto the Maryland Responds webpage.
Great. Well, thank you. Well, I hope lots of people listening today say yes. You know,
Yes.
I think I would like to do that. I'd like to volunteer to be a public health preparedness and response volunteer, and just let me sign up. I'll go to that Maryland Responds website and sign up.
Thank you.
Great. Thank you very much. And now please stay tuned for this month's Medical Myth.
Getting your flu vaccine is the best way to prevent getting the flu and possible complications from the flu. People most susceptible to the flu include children 5 years old or younger, people 65 years or older, pregnant women, people with health issues such as asthma, diabetes, and heart disease, and people who take medication that might weaken the immune system. If you have the flu or want to avoid getting the flu, here are some pointers. Cover your cough and sneeze with your arm or use a tissue and wash your hands. Wash your hands with soap and water. If not available, use a hand sanitizer. Avoid touching your eyes, nose, and mouth. Avoid being around sick people. Stay home from school or work if you are sick until you are free of a fever for 24 hours. Contact your healthcare provider if you are sick. To learn more about the flu, please call the Health Department Flu Information Line at 301-600-3035 or visit frederickcountymd.gov/flu.
Did you know that all of Frederick County's mixed recyclables go to a materials recovery facility to be sorted? For this to happen, your recyclables need to be placed into a cart or bin loose, not in bags. Trash bags are not recyclable, and materials in bags are difficult to open at the sorting center and are not accepted. The only exception to this rule are recyclable plastic bags, like grocery store bags, which do need to be gathered together inside of one bag so that they don't get caught in the sorting facility's machinery. Also, shredded paper should be placed inside a paper bag or cardboard box so that it can be collected and sorted properly. Thank you for helping to make recycling work better for our community. And remember, please don't bag your mixed recyclables. More information on our recycling program can be found online, in our mobile app, or by calling our office. Recycle more, waste less.
The Frederick County Department of Housing can help retired homeowners 55 or older with limited income receive assistance with home improvements. 0% interest, 30-year payment-free mortgages pay for such eligible improvements as widening of doorways, exterior ramps, accessible showers, or even additions like first-floor bathrooms and laundry areas in some cases. This is not a reverse equity mortgage, and all closing costs are included in the loan. The Housing Department will assist you with completing the simple application, choosing a contractor, and making sure the improvements are completed safely and efficiently. For more information, contact Susan Brown, Housing Rehab Programs at 301-600-3531 or by email at sbrown@frederickcountymd.gov or visit our website at www.frederickcountymd.gov/housingrehab.
Did you know a person can have colorectal cancer and yet have no symptoms? Symptoms of colorectal cancer may include bleeding, blood in the stool, abdominal pain or mass, and changes in bowel movements. Ask your doctor if you should be screened for colorectal cancer. Call the Frederick County Health Department at 301-600-3362 for more information or for free colorectal cancer screening for eligible individuals.
And now here's this month's medical myths. This month's medical myths will focus on lung cancer. The first myth that I hear is that it really isn't a problem anymore. The fact is, lung cancer is the leading cause of cancer death in Frederick County, causing 500 deaths in Frederick County in the years 2005 to 2009. The next myth that I commonly hear is that women don't need to worry about it. The fact is, more women in Frederick County die from lung cancer than die from breast cancer and colorectal cancer combined. Another myth is that the only known cause of lung cancer is tobacco exposure. The fact is, tobacco exposure, including secondhand exposure, is the #1 risk factor for developing lung cancer, but there are also other risk factors that you can take steps to prevent, such as exposure to radon. Radon is a naturally occurring gas that comes from rocks and dirt and can get trapped in houses and buildings. Radon is considered the second leading cause of lung cancer in the United States. Frederick County homes have the highest potential rating for indoor radon detection, according to the EPA. Another myth is that there is no proven beneficial screening test available for lung cancer. The fact is, there is now growing evidence that there is a screening test that overall does more good than harm if people who are screened have all three of the following risks. The first is that they have a history of heavy smoking, and that's considered a 30-pack year history of an average of 1 pack a day for 30 years or 2 packs a day for 15 years. 2, they smoke now or have quit within the last 15 years. And third, are between the ages of 55 and 80. That screening test is available in Frederick County and is called a low-dose computed tomography or low-dose CT scan. The final myth is that for smokers, the damage is already done, so there's no benefit to quitting. Well, the fact is that there is really good evidence that your risk for lung cancer goes down when you quit, no matter how old you are or how long you have smoked. It's never too late to quit. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Behavioral Health Services Division. National Suicide Prevention Week is September 7th through the 13th. According to the Centers for Disease Control and Prevention, in 2010, suicide was the 10th leading cause of death for all ages and the 3rd leading cause of death among persons aged 15 to 24 years. The 2013 Youth Risk Behavior Survey results showed that almost 25% of Frederick County high school students reported that during the last 12 months they felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some usual activities. The same survey revealed that almost 16% of Frederick County high school students seriously considered attempting suicide. The best way to prevent suicide is to recognize the warning signs. Major warning signs include talking about killing or harming oneself, talking or writing a lot about death or dying, and seeking out things that could be used in a suicide attempt, such as weapons or drugs. These symptoms are even more dangerous if the person has a mood disorder, such as depression or bipolar disorder, suffers from alcohol dependence, or has previously attempted suicide. If you believe a loved one is suicidal, you may be afraid to bring up the subject. Talking about suicide does not increase the likelihood of suicide. In fact, just the opposite is true. Some ways to start a conversation are to say things such as, "I have been feeling concerned about you lately," or "Recently I have noticed some differences in you and wondered how you're doing." Questions you can ask include, "When did you begin feeling this way? How can I best support you right now? Have you thought about getting help?" Let the person know you care, that he or she is not alone. The right words are often unimportant. If you're concerned, your voice and manner will show it. If you believe a friend or a loved one is suicidal, you can play a role in suicide prevention by pointing out alternatives, showing that you care, and getting a doctor or a therapist involved. If you or a loved one are in crisis, please call the Frederick County Crisis Line at 211. The Frederick County Health Department offers psychiatric services. Please call 301-600-1755 for more information or visit us online. For more information regarding suicide prevention, please see the CDC's Violence Prevention page. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.